Living longer, living healthier, living better than ever before. Welcome to Mountain Pacific's Healthy Living for Life, a weekly series that gives you the information, education, and expert insight you need to become an active participant in today's ever-changing healthcare climate. Here now is today's program host.
Welcome to the premiere of Healthy Living for Life, a weekly series sponsored, produced, and hosted by Mountain Pacific Quality Health. I'm Sarah Medley, your host. Healthy Living for Life will cover topics like caregiver burnout and reducing the cost of healthcare. We'll have experts who can offer tips for staying safe in the hospital and getting the most out of doctor visits. I'm proud to bring you programming that will have a real impact on your life and your health. Stay tuned. Welcome back. I'd like to begin by giving you the background on Mountain Pacific, its history, why we're doing this show. I'll also talk about the important work our teams are doing that could directly impact you. For the past 40 years, Mountain Pacific has been dedicated to improving the health of and healthcare provided to the populations we serve. Our reach is much wider than Montana. We also serve Wyoming, Alaska, Hawaii, Guam, American Samoa, and Saipan. If you look at a world map, superimpose our region over the United States, our service area covers all of the U.S. and then some. Much of our region can only be reached by plane or boat. Our state and federal contracts allow us to oversee the quality of care provided to Medicare and Medicaid members. We work within our communities to help improve health care and the systems that provide it. Our goal is to increase access to high-quality health care that's affordable, safe, and of value to the patients we serve. We have our corporate office in Helena, offices in Casper, Anchorage, Honolulu, and as just a few months ago, a small office in Guam. Almost 40% of our 132 employees work out of their homes. The qualifications of our staff range from physician, pharmacists, and nurses to software engineers, statisticians, and health information technology experts. We're governed by a board of 19 dedicated individuals representing all the states and jurisdictions we serve. The board meets face-to-face and by phone. Having just returned from a winter meeting, I can attest that our board is passionate and dedicated to helping staff do everything we can to improve the lives of those we serve. The expertise on that board ranges from health economists, business leaders, geriatric lawyer, physicians, and consumers. In addition, CEOs representing the Hospital and Medical Association are also members. But you know, in spite of all I've shared so far, I bet you've never heard of Mountain Pacific. Maybe I can change that. We've been in business since 1973, originally formed by the Montana Medical Association in response to a law that required organizations like ours to work with communities and organizations, but most importantly, to work on quality and peer review. We conducted quality review studies, utilization review studies, and with the enactment in Medicare in 1965, there was concern that the Medicare Trust Fund would run out of money. And why were they concerned? Well, because back then, if you fractured a hip, so you broke your hip, you fell, your length of stay might be up to 14 days. Imagine that. But today, you fracture your hip, you're in the hospital maybe 5 to 6 days. So obviously, they needed to be sure that Medicare wouldn't run out of money. So in addition to other issues and work that we do, we started working in Wyoming. We were asked to bid on the Wyoming contract and got the Wyoming contract in 1986. In 1996, we were asked to work in Hawaii, and we changed our name to Mountain Pacific Quality Health. And then in 2005, we got the Alaska contract and started working in Alaska. So what do our staff do? Let's talk about that. Well, imagine being in a nursing home and working in that nursing home on all kinds of quality review things like decubitus ulcers, depression, antipsychotic use, and we want to make sure that all of those issues are taken care of in a positive way. How about hospitals? What do we do in hospitals? Well, we work with physicians, we work with organizations, we get everyone sitting around a room, and we work on making sure that patients are not readmitted too frequently and that their care is coordinated. All of these things take staff scattered all over the United States. So what else do we do? Let's talk about our Medicaid work. For over 30 years, we've worked with the Department of Public Health and Human Services, working on everything from transportation review to drugs utilization review and case management, making sure that our Medicaid members are treated well and efficiently and effectively. Another thing we do is health technology services. We have a department, Health Technology Services Department, that helps physicians and other providers use their electronic health records in a way that drives improvement. And then finally, we work with patients directly on immunizations and a whole host of other things to make sure that those patients are being taken care of. Some other team members also work with hospitals and other organizations in a variety of ways. Other team members work with hospitals and other healthcare organizations to identify patients who are bouncing in and out of the emergency rooms and hospitals. Once identified, our team can help the hospital professionals figure out how to better coordinate the patient's care to keep them out of the hospital and out of the emergency room. While Healthy Living for Life is broadcast only in Montana and northern Wyoming, it will be posted to YouTube. So our programs will have nationwide reach. Today's healthcare climate is ever changing, and we hope this program, its guests and topics are of value to you and your loved ones. I'll see you after the break. Stay tuned. My next guests are Mountain Pacific colleagues who will be hosting future episodes of Healthy Living for Life. Please welcome Janet Whitmoyer and Lisa Sather. Janet is the Director of Medicaid Contracts. Lisa is the Director of Clinical Pharmacy Services. I'd like to start with you, Lisa. Good morning.
Good morning, Sarah.
Can you give our viewers a glimpse into the great work you and your staff are doing?
Sure, I'd love to. Thank you. And thank you for having me. I think it's important to let our viewers know that not all pharmacists work in a traditional pharmacy setting where you show up at a pharmacy counter and get your prescription filled. There are teams of pharmacists working kind of behind the scenes to help develop policies that help guide our programs, prescription drug programs. So with that, our Mountain Pacific team of pharmacists and pharmacy technicians does work for various state organizations, including Montana Medicaid. We are part of a group that is, we have oversight by a board of pharmacists and physicians that help us to develop and implement policies that improve the quality, the safety, and the cost effectiveness of prescription use in patients. So that's kind of that in a nutshell. In addition, we have a very exciting program that we work on called the Ask a Pharmacist program. And I'd like to give you a little bit of an overview of what that's about today, if that's all right. You know, we all have prescription plans, and we know that it's sometimes very difficult to understand what prescriptions are covered, if there are anything that might be better for patients that cost less. And so that's part of what our pharmacy team does. We're able to help members navigate their prescription drug formulary, help work with their providers to come up with lesser expensive prescription medications if necessary. In fact, just last week, I received a phone call from a 91-year young gentleman, and I'd like to share this story with you, if that's okay.
Please.
Yes, so he gave us a call, and he had been to his doctor a couple of weeks before and received a brand new prescription for an inhaler medication to help with his breathing. And he took it to the pharmacy to get it filled and was told by the pharmacist it would be $360 for the one prescription. Needless to say, like many of us who this potentially has happened to, he left the pharmacy and didn't take his medicine with him. He tried for a week or so to reach his physician, but was having trouble navigating the telephone system and eventually gave up, and that's when he gave us a phone call. I said to him, you know, we'll work with your physician, let me give him a call, and let's see if we can come up with something that is as effective for your condition, but is within your formulary and will cost a little bit less. And we did just that. We were able to identify a prescription that would cost him $60 instead of $360. And needless to say, he was ecstatic. We arranged to get that picked up that day, and he was able to get started on his medicine right away. And that's just one example of one of the services that we provide that makes a huge impact on members' lives.
Oh, thank you, Lisa. What an impactful story.
You're welcome.
I appreciate your
Absolutely.
sharing it.
Yes.
So, Janet, it's your turn. Can you talk about some of the great things that you and your staff are doing each and every day?
Absolutely, I'd love to share. Well, we are a team of nurses, social workers, and specially trained staff that work with the state of Montana to make sure that Medicaid members get the most effective service in the most cost-effective manner. That's really it in a nutshell. And in one of our programs, we work with disabled members who really have a lot of long-term care needs. And these are folks that are really at risk for ending up in a nursing home. But for most of them, they can be very independent if they just get a little bit more support and assistance at home. And we had a real recent situation which tells us how valuable this service really is. And so this story comes to us from a lady who actually had lived most of her life in the southeast part of the United States until recently when she moved to Montana to live with her family. And then subsequent to that, the family decided that they were going to relocate to Alaska. So when they got to the Canadian border, they realized that this lady's paperwork, for whatever reason, wasn't complete, and she was unable to cross the border. So unfortunately, the family just left her there with really nothing. She had her suitcase, but she didn't have any money, and she didn't have a phone, and she really didn't know anybody who she could reach out to for help. So the Border Patrol took her to a homeless shelter in a nearby community where she actually lived for a period of time until she was able to get into an apartment complex. And that's where she found out about this program and our services. So she reached out to us asking for help. One of our nurses met with her in her home and quickly identified that she had several unmet health care needs. First being that she didn't have a health care provider. So we were able to help her establish with the healthcare provider, which was really fortunate for this lady because she ended up being diagnosed with cancer. But the good news for that was that she was able to get the treatment and the necessary medications to treat her cancer as well as her other healthcare conditions. We also helped this lady get in-home care services where we actually had a person come into the home and help her with her personal care needs and her activities of daily living, so that she's really pretty independent at home now. And finally, we were able to connect her with the community case management team who is overseeing the care plan that we've developed for her to make sure that ongoingly her needs are met. And to me, this is really what Mountain Pacific is all about. We are, one of our corporate values is that we treat people the way we want to be treated. And so this is an example of how we're doing just that.
Oh, what a terrific story. Thank heavens you and your team were there to help this woman. Absolutely. Ladies, thank you so much for sharing your stories and the great work you're doing.
Absolutely. Thank you, Sarah.
So, up next, you're going to meet a Mountain Pacific board member. Stay tuned. We'll be right back. Welcome back. As promised, I'd like to introduce you to Dr. Jonathan Griffin, a Mountain Pacific board member and the medical director for Blue Cross Blue Shield of Montana. Good morning, Dr. Griffin.
Good morning, Sarah.
Great to see you.
As always.
So we've got a couple of questions for you. So my first question, in addition to the work you do with Blue Cross and Blue Shield, I know you're also a medical director, several skilled nursing facilities. I also know that you work on community-based initiatives. You're passionate about electronic health records, and you really want to use those electronic health records to drive improvement. But my question is, what made you say yes when we asked you to be a Mountain Pacific board member?
How could I not have said yes, Sarah? You know how important Mountain Pacific is to me with respect to the work that's being done there, the staff at Mountain Pacific. It was an inevitable yes. And back in 2011, I'm not sure if you're aware of this story, Sarah, but I was new at St. Peter's Medical Group and giving a talk at a continuing medical education conference on patient-centered medical homes and accountable care organizations. Janice Connors was in the audience and approached me after that talk and asked me to come and give that same presentation to the board as a form of education for board members. And so I said yes, and since that time, really I think that we both have done a lot to nurture our relationship. We've had a number of projects where we've worked together to build tools for providers and helping them improve their quality within their practices. We've done a number of things with grant efforts, and that work continues today. So I believe in the mission of Mountain Pacific. I believe in the work that Mountain Pacific does, and most of all, I believe in the people at Mountain Pacific. So I am proud to be a part of the organization and to serve as a board member.
Wow. Well, thank you for those kind words, and I know our staff appreciate all the great work you're doing. So you know that a large part of the work we do focuses on improving the quality of care to Medicare patients. And as the medical director for the largest insurance company in Montana, can you talk about some of the improvements of care that you've seen that might be either directly or indirectly related to the work that Mountain Pacific does?
There's no way that I will be able to summarize the breadth of things that Mountain Pacific is out doing to ensure that care is of the highest quality. But one of the foundational services at Mountain Pacific is maintaining a high standard of care within many facilities across the state, and helping to facilitate those kinds of activities, making sure that patients are being cared for in the most safe and effective and efficient manner possible. Some specific things, of course, there is the work that was done with the Regional Extension Center to help promote the adoption and implementation of electronic health record systems across the state. And really much of those efforts, as you know, was focused in the rural small communities. These are unsung heroes, really, I think, working in the background to really support those practices and taking on and adopting this new information age that was foreign to many people. The Transitions of Care initiative, I think, was a big one that needs to be called out. Mountain Pacific facilitated community-wide discussions with focus on moving patients from the hospital to their home and trying to do everything possible to keep them out of the hospital, providing support for their needs at home to just ensure that those transitions were occurring as smoothly as possible. And so that was a great effort. One of the recent projects that I think is incredibly innovative is the Community Resource Coordination Program that Mountain Pacific is leading. And this is having tremendous impact, because not only is it focused on working with the healthcare delivery systems and home health agencies, but it's reaching out to other community stakeholders like Housing Authority or Meals on Wheel program, or even church groups are getting involved in these activities. And I know of several examples where people's lives are changing, and it's impacting, of course, that individual, but it's also having tremendous impact on the healthcare communities themselves with respect to just being able to manage these most high-risk individuals in their communities. And so there's a number of things that Mountain Pacific is out there doing, but those are a few that come to mind.
Oh, that's great. You're a real spokesperson for Mountain Pacific. We appreciate that. So I talked about your electronic health record passion. So can you talk to our viewers about how electronic health records improve what you just talked about, improved care coordination or improved readmission, so patients are not bouncing back and forth between the hospital and the ER and then back home again?
Sure.
How do those electronic health records help?
Well, information, as we all know, is the key to making any sort of informed decision. And health records, when they are in a paper chart somewhere on a shelf in a practice, it's difficult to have the type of information that you need, you know, when you're working individually with somebody at the point of care to make decisions about medication changes or what sort of tests or interventions need to be pursued. So at the point of care, it's really important to have a broad view of information of this individual who's sitting here with you to make informed decisions. Then of course, there's just being able to gather information on populations of patients. There's no way to do that in kind of a paper-based world. It requires some analytics and informatics support to be able to generate the types of reports that we need to be able to identify individuals out there in the communities that will need help. So
That's great.
Really at all levels of care, information
Thank you
is key.
so much.
You bet.
It's always a pleasure to talk with Dr. Griffin. Well, we're out of time. But until next week, remember to stay fit, stay well, and stay healthy for life with Healthy Living for Life.
Healthy Living for Life is brought to you by Mountain Pacific Quality Health. We'd love to hear from you. If you have suggestions for future programs, visit our website at mpqhf.org or call us at 406-443-4020. You can also catch us on YouTube by visiting our website and clicking on the YouTube icon. Special thanks to Fire Tower Coffee House and Roasters. Production facilities provided by Video Express Productions.